Well, good morning, ladies and gentlemen. And because I was communicated that we are social distance enough from y'all, I'm going to take my mask off for the presentation and the overview. But we want to welcome you back to work. More importantly, the excitement to seeing everybody come through the doors again. We've been down for about 4 months, and there's a lot of excitement, and the energy will continue to build come Wednesday morning. But with that energy also is coming some concern, some stress, some nerves, and so we understand that, and we want to make sure that staying healthy is rule number one, so that MotorCity believes that the customer and the associate's health is top of mind for us. And so what Bruce and his team wanted to do was make sure that we provided an overview of the COVID-19 safety policy. This policy will be available for you all very near future to download in its entirety, but we wanted to make sure that we gave you the key points, the highlights here. And so with that, we asked Bruce to come on in and give you a warm welcome and kick this all off for us. So thanks, Bruce, for everything, and welcome.
Good morning, everybody. Hey, let me hear the people over in the convention center. Good morning, everybody. There we go. Well, hopefully you're happy to be back to work. Thank you. Yeah, I don't think anyone would have guessed we are where we are right now, and I'm not 100% sure where we're going, but at least we're getting an opportunity to operate, and we do have a lot of protocols that Al's going to go over to make sure everyone stays safe. Couple key points. I'm not going to go, Al's got quite a PowerPoint for you, but a couple key points I think for everybody. One, if you're sick, stay home. There's no reason to come to work. If you have symptoms of COVID, stay home, okay? We're doing, like I said, I'm going to just give you some of the things we're doing, but that's number one. Number two, wear a mask all the time. I hate it. Everyone hates wearing a mask, but it's absolutely necessary to protect everybody that you wear a mask. Socially distance. Even when you're wearing a mask, you guys are all spread out 6 feet apart if you look at what you're doing. Obviously, we did that for a reason, but you can do it when you're here too, when you're in the employee dining room. We all have a natural need to want to get close to one another and talk to one another, but for a while, until we can get a vaccine, we need everyone to stay apart. So the masks are very much help, but they're not 100%. So they're 98% depending on what you read, but that gives that opportunity. So if you socially distance while wearing a mask, it's much, much harder to contract COVID. And then lastly, follow the signs. You're going to see you saw the footprints as you walked in. You're going to see arrows directing you around. We have one-way traffic through all the hallways now, so you're not passing people. Again, it's highly unlikely you would get it passing people, but again, it's easier not to do it to make sure. So some of the things we've done, you saw the employee screening as you came in today. If you got your test done today, but over in the valet drop-off, we've created an area to temperature check every single customer who comes into the building. They'll stay in their cars. If they test over 100.4 degrees, we won't allow them in. Again, safety for everyone. Because quite frankly, what we found with COVID is sometimes they call it asymptomatic. You don't even know you have it, but you do, and you can pass it on. One of the things we're doing is we're checking every employee before they come to work, certainly interface with the customers, and actually that's a good thing. It was the city of Detroit requested that we do it, and so far we found 5 people who tested positive. So we were able to turn them around or keep them from coming in and getting other people sick. So when you test 1,200 people, it gets a little expensive, but clearly it's well worth it to make sure people coming to work don't have COVID. We've added UV sanitizers to the escalators. We've added nanoseptic film you're going to see on the crash bars and all the handles throughout the building. It's a special film that lasts for 90 days and it kills the bacteria immediately upon touch. So again, something to keep everyone safe. We've added plexi to the cage, club booths, sportsbook, and tables. I may have missed one. This is an all-inclusive list, but just some of the things that we've done. As we move in you'll see the social distancing both in the restaurants and in the employee dining room. There's only one chair per table. And then when you get onto the floor, you're going to see virtually every other slot machine turned off. Again, to promote social distancing. But it's all of our responsibilities to make sure our other employees as well as our customers follow the rules. Because when people don't follow the rules, that's when there's a weakness that somebody could get sick. So lastly, I'm going to just ask for a big favor. I want you to look around the room that you're in. There's only 10 of you, but look at the other 9. Just look around, take a look at one another. You're responsible for the other 9 people. You're not responsible for yourself, you're responsible for the other 9 people. Because if you don't wear a mask, if you don't follow the rules, and one of them gets sick, that's on you. So it's really, really important. And again, we're only going to be able to operate as long as we don't become a hotspot. And it can happen. Luckily, we haven't seen it in any casinos because people are generally following the rules. But again, you're responsible to make sure that we stay open. That's 1,200 people's jobs on the line every day. So look around again and remember that you're responsible for all of the other employees. And they're responsible for you. If we stick with that, we'll be good. With that, I'm going to move on. We have a couple press interviews to do today. We're going to show off MotorCity Casino for the gem that it is. Again, thank you and welcome back.
All right, well, thank you again, Bruce. Certainly appreciate that. And because there is a lot of information that we're going to be sharing with you within a short time frame, we're going to ask to hold any questions during this overview. What we will do is share with you contacts at the end of this session on who you could reach out to. Of course, if you have any questions when you get to work, it will be your director, your manager, your supervisor, HR, and we'll go over all of that. So I certainly want to thank you in advance. Also, for those out there in the conference center, ballrooms, you're going to see the presentation, and we're going to make sure that we communicate the information that certainly needs to be communicated. So, with that, what are we going to cover? We're going to cover the 4 pillars, and Bruce mentioned that, and those have been out on our website, Create the Escape, as well as our customer sites for our customers and us to take a look at for at least a month. We're continuing to update this information, and we'll continue to share this information. Again, Bruce stressed, if anyone is sick, please stay at home. We're in this together, so we want to make sure that we do just that. Those 4 pillars that we are going to go over are screening, social distancing, items for personal protection, MotorCity Clean, and then we'll share some property updates, miscellaneous updates, and some healthy tips. After the presentation, if you do have a meeting or a training with your team, we'll tell you where to go. If not, we'll just exit out the soundboard, exit behind the stage, because we'll have other people coming in for the next class. So the 4 pillars. The 4 pillars are core concept that we will need to adhere to as we transition back to work. These pillars will keep ourselves and others safe, so it's important to learn the following guidelines associated with each. We're implementing a strict screening procedure. As Bruce mentioned, we all went and got COVID testing, but this will also include temperature checking for both us as well as our customer, and a series of questions that we'll review. Social distancing is occupancy capacities for the property at large, as well as for specific areas, have been reduced. Helpful signage and social distance markers have been placed in queuing and dining areas to remind customers and associates to seek to maintain social distancing, and we're limiting face-to-face customer-associate interaction whenever feasible. Now, again, we are in the service industry, and Pam, you mentioned it this morning already. Here, we are very well known for being friendly, and we can communicate our warmth and welcome with those smiling of the eyes in the conversations that we have with our customers. We'll increase the frequency of cleaning and sanitizing, especially of frequently touched areas, with the goal of ensuring cleaning products are used that meet or are above the standards out there set by OSHA or the EPA. And then finally, items for personal protection may assist personal protection, including masks that are required to be worn by us, the associate, as well as our customers, any vendors, and guests who enter the facility. So the first thing we want to communicate again is if you're not feeling well, please stay at home. I know in the past we've been troopers if we felt not the best and we said, hey, we're going to come into work, but this really is a different mindset. If you're sick, you're not feeling well at all, stay home. We're going to go through the procedure, who to contact, who to communicate in a few slides, but it's really important to message. In fact, seriously, if you're sick, stay at home. What does that mean? You know, what are some of those symptoms? How do you define sickness? So due to the ongoing COVID pandemic, associates should not report to work while they're ill or experiencing any one or more of the following symptoms: fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So those are symptoms. These symptoms, have you been watching over the last 4 months, that this list continues to grow, or they even grouping them up. We'll get that information as it comes out. We've got various networks to get that information out, and we'll continue doing that. So the first of the 4 pillars is screening. And so all employees will be screened daily. Anyone expressing symptoms of COVID-19 or who has been in close contact with an individual with a suspected or confirmed case of COVID-19 will be required to stay home from work. So as you did today, we're going to park in the Ohio lot or the associate parking structure. Some of us are used to use that door from the hotel. That door is locked. The only access to work at this time is through the conference center. And again, as Bruce mentioned, and we'll mention more than enough times here, they've spent a lot of time and energy on communication. So follow the signs. You're going to see signs on the ground, on the walls. You'll probably see them hanging from the ceiling. You'll see signs, and they're here for all of us to create that environment. Once you walk through the door, again, we're going to do a scan or check of our badge, whether it's a MotorCity or gaming board, as well as the bag check itself. So one of the things that we'll ask again is to limit the personal items that you bring in. So whether it's a hat or gloves, briefcase, water container, lunch, whatever it is, we just ask that we keep it to a minimum. There are 3 screening questions. This morning when you walked in, we had it listed up there, but I certainly want to go over each one of them. The first one is, have you been diagnosed with COVID-19 within the last 14 days? Number 2 is, do you have any of the following symptoms? Fevers, chills, coughs, shortness of breath, difficulty breathing, fatigue, muscle, body aches, headaches, new loss of taste or smell, sore throat, congestion, runny nose, nausea or vomiting or diarrhea. And I think listening to that list might be creating another symptom, but in all seriousness, we really got to understand what we're asking. And the third one finally is, within the last 14 days, have you had close contact with an individual or who has been diagnosed with or suspected of having COVID-19? And what does it mean to be close contact? And that's typically within that 6 feet for more than 10 minutes. So whether you're having a conversation with somebody outside of work and you find yourself within that, that's definitely a definition. Another one is an infected person who's coughed or sneezed on you, or us touching or grabbing something that has been coughed or sneezed on or contaminated. All of these questions are answered no, then we can move forward. If any of those 3 questions are answered with a yes from any of us, we're not going to be able to enter the building. Once we do answer no, we're going to move on to the temperature check. And the screening personnel will utilize a no-touch thermometer, so they're not going to touch us here. And the reading will be confidential. I know today we're asked to read it and put it on down. If we are below 100.4, we are able to enter the property. If our temperature is 100.4 or more, we're actually going to not be able to go immediately into the property. We're going to go to a secondary temperature check. And in that secondary temperature check, there'll be a waiting period. So again, if you have a temperature of 100.4 or higher, we're going to go into a separate waiting area that's confidential. We'll wait for at least 10 minutes, and then we'll have EMT or officer go ahead and give us another temperature check with a different thermometer. If that temperature is still at 100.4 or more, then you're not going to be able to enter the building. It will be provided a care document from the CDC, the Center of Disease and Control and Prevention, and then the screener will communicate with HR, and they'll collaborate with you on next steps. And then those series of steps may include getting that clearance from the Detroit Health Department as well. If you feel sick at work, and we're going to go over this in a little bit more detail as well, immediately notify a pandemic response officer. So on our property right now, we have Satara Anderson and Wendy Richardson from Human Resources. Or communicate to your supervisor or anybody in Human Resources, and they're going to go ahead and take us in and do that secondary screening, but I'm going to get more into the specific process later on in this presentation. Another pillar is social distancing. We know you may not have seen your coworkers in a while. We want to hug, we want to high-five, shake hands, and we're asking, obviously, please don't do that. There'll be a day again when we can do that, but certainly not here. For the sake of safety for yourselves and others, we ask to resist doing that. Social distancing, also referred to as physical distancing, is a simple yet very effective mechanism to prevent potential infection. According to the CDC, individuals should stay at least 6 feet away from one another, a form of social distancing to help prevent the spread of infectious virus. There are guidelines on social distancing to minimize the spread of COVID-19 among associates. So again, we know that we're in the service industry, and we're going to talk about what happens when we find ourselves within a situation of 6 feet, because again, we interact with guests. We do have measures and equipment for protection on that. One of the things I've mentioned a couple times is following the signs. Signage and markers you'll find throughout the property. They'll talk about closed areas, areas not to walk, social distancing areas, arrows to point. One of, I think, the biggest changes we'll notice when we come back to work is the one direction that we find. A great example of that is, we'll get into it when we're walking the heart of the house into the ADR or a wardrobe, but also the bridges. So the West Bridge is for the associates, and that's where we'll transfer. back and forth, and then the guest will use the East Bridge. And that'll allow us to track our guests and the capacity number. We're running at limited capacity, so we want to make sure that we're able to do that, and that's why they've changed that around. And again, signs are all over the building, and they'll get us from one point to the other as safe as possible. Some of the social distance measures, so plexiglass barriers are out there. If you walk by the hotel or Club Metro or the Cage, you'll see plexiglass. I know they're starting to put some plexiglass on some gaming tables as well. If we find ourselves within 3 feet of somebody and there's no plexiglass barrier able there, that we will have face masks available. And again, we'll talk about face shields, and we'll talk about that when we talk about the equipment itself. We also reduced the gaming capacity, so 15%, and you'll see slots, I believe, roughly every other one. We just make sure that they're 6 feet apart there, and then table games has a reduced number of seating as well. Guests are prohibited from standing beside or behind players, and I think that's something that we see in the gaming culture quite a bit. Security is going through some training as well. They have protocols in place to communicate to the guests as well. But again, just like checking ID, if we see something like this, politely ask, hey, this is prohibited, we can't do this. If you feel uncomfortable, go directly to your supervisor, your manager, the pandemic response, a security officer, but we got to make sure that we abide by that. Some of the things to avoid in relation to social distancing, again, shaking hands and congregating. And again, I think I've heard there'll be people out there, the gaming board will be out on the floor, they'll be auditing and checking things out. Nobody's up here trying to scare you, but I do know that we're taking this really serious. The governor's office, if you've seen some of those presentations throughout these last few months, the gaming board, they're all going to make sure that we're following our protocol. So we got to do our best practice. We'll talk about we have any concerns or questions where to go for that. Touching surfaces touched by others when possible. So again, there are items there. There's surfaces that we want to avoid. Meeting people face-to-face when possible, whether it's a meeting, whether it's an interaction that doesn't need to take place. We want to make sure that we avoid that. And sharing personal items, whether it's a pen or a cell phone or a laptop, any of that, please don't share that either. And of course, these practices would be also encouraged outside of work, so we don't wake up one morning and find out, or day or evening, whatever our shift is, and find out that we do have a symptom and we know that we shouldn't come to work. Some social distancing tips. We're encouraged to use telephone, online conferencing, email or instant messaging to conduct business as much as possible, even when participants are in the same building. In a face-to-face meeting, if is unavoidable, minimize the meeting time, choose a large meeting room, and sit at least 6 feet apart. So this is, I think, one of the first times where we can say soundboard is sold out to capacity with 20 people participating in here. So again, we take this very seriously. We broke up the ballroom into 7 different rooms as well, and that's why we're going over this overview within an hour as well, and then we'll share with you where you can get additional information and your questions answered. Another pillar, items for personal protection. Or PPE includes nose and mouth protection, eye protection, face shields, hand protection, or gloves and uniform coverings. The company will consider whether other PPE is necessary, such as face shields. So, for example, again, if we can't constantly maintain 3 feet of separation of other individuals in the workplace, the company will consider whether face shields should be implemented. If you have any questions regarding that, obviously ask your supervisor or manager as well. Your department may have additional requirements regarding these items for personal protection. Masks and face shields. So associates are required to wear face coverings. Everybody who comes into building ours is required to use face masks or face coverings. Guests may remove face coverings as well as us only if we're asked for identification purposes or for eating and or drinking to the extent necessary. Office, if you're in the office, we're again encouraging you to wear that mask. Even though we think we're cool with it, we want to make sure that we're comfortable. Also, if you're wearing your mask and you touch it to adjust it, and we'll get into this too, washing your hands, using sanitizer. That's what that mask outside, as you know, is to catch those contaminants. So if we're using it and adjusting it, we're potentially contaminating ourselves and then potentially touching our face, and certainly want to avoid that. So masks and face shields. Masks are provided to each associate. Some of you, as you came in, were given those 5 face masks, and others will get back to you. You'll reach out to Human Resources. Somehow we'll make sure that those are available to you as well. But those 5 are ours to take ownership with. And if we lose or misplace those, we'll have a temporary one, but we're responsible for that, and I think we can have or get additional ones for purchase through HR. We'll talk about the do's and don'ts. Face shields, already mentioned. Certain positions, certain tasks will be required to have those face shields. Offices and conference rooms with 2 or more people, again, masks are still used. We try to limit the time in there as much as possible. And again, touching and or adjusting that mask, we want to make sure that we avoid that or use that sanitizer or washing hands before we touch our face. So mask and face shields do's. So first one is cover the nose and mouth completely, usually from the bridge of the nose to the bottom of the chin. One of the things that we often see is we're talking to somebody and all of a sudden it drops below our nose. That's got to be unacceptable. If we see a customer, if we see a fellow associate, let's call it out and make sure that we cover them. I think I was watching the show and somebody gave an example, here's the face covering and then here's a chin mask. We're asking you to wear a face mask, not a chin mask. So let's make sure that we keep it thoroughly covered. Adjust if necessary. Again, if you do, we usually talk about putting it on and taking it off by the straps themselves as opposed to adjusting there. If you do, please sanitize your hands. Wash your hands after removing. Keep it clean. Keep it on your person. So a lot of times we see people setting it on the counter. This is something that we've got to break that habit of. The best place, they say, is in a sandwich bag. And if you don't have a sandwich bag, in your pocket, on your person is the best place for it, as opposed to setting it on a potentially contaminated surface. And then request a new one if damaged. Some of the don'ts, don't let it obstruct your vision, whether it's a face shield sliding down, make sure it's securely fastened or fastened properly, making sure that we wear it and it doesn't cause us difficult breathing. Now, masks are required by all. If you have a concern with that, obviously go right to HR and communicate that concern, and they'll work with you trying to figure out what the best steps are. Don't let it fog your glasses. And I know I wear glasses too, and I don't have it right now, and it's hard to read the screen in some of the notes. But we got to make sure that that doesn't fog up as well. There's all kinds of different fixes out there. So I think anybody that wears glasses probably has already checked that out. And certainly don't use it if it's damaged. Don't hang it around your neck. And again, don't lay it on surfaces where they could be contaminated. Gloves and uniform covering. So gloves are provided on certain jobs. Initially, you would think gloves would be handed out to all and it would be protection, but it doesn't. It really creates a lot of cross-contamination, so you've got to be smart on what tasks require gloves and which tasks don't. So we'll talk about the do's and don'ts there. Uniform coverings, there's a few tasks here. If somebody is suspected of having something, the officer, the EMT will have a uniform covering. There might be a few other rare instances, but for the most part, I think our uniforms are there. And your departments will specify if those uniform coverings will work. So change gloves when soiled or after any task. And one of the things that I kind of think about is when I'm in my kitchen and I'm working with food and say I'm getting ready to barbecue or smoke some chicken breast and I've got my gloves on and I'm cleaning the chicken and all of a sudden I realize I got to grab spice. And the first thing I do is when I reach out for the spice rack, I say I can't touch it because already I've got whatever's on my gloves, so you end up taking it off. We've got to be really cautious to make sure that when we're wearing gloves, they're for the right tasks, and when we go into the next task, we take those gloves off. And there's a protocol for donning and doffing gloves as well, so if your position requires gloves, you'll get that additional discussion on how to do that. Dispose of gloves appropriately. So here is in the garbage can. I think when this first broke out, we heard a lot of news stories about a bunch of dirty gloves in supermarkets and store parking lots because people didn't know what to do with them. So please, let's make sure, again, tissues or anything are disposed of. And then, of course, wash your hands when you take those gloves off. Associates are required to wear disposable gloves under certain circumstances of assisting an associate who becomes ill at work or handling food or beverage materials that will be distributed to other associates. They'll be available in common areas throughout the building, including pantries, kitchenettes, coffee rooms, and food outlets. Security also has specific tasks that they'll be required to wear gloves as well. The last of the four is MotorCity Clean. This section provides information on the steps you've taken to promote workplace cleanliness. We ask all associates to cooperate in taking steps to reduce the risk of transmission of COVID-19 in the workplace. Best practices include taking steps that are your individual responsibility, as well as following procedures to keep the safety of the facility itself. So there's both individual and facility responsibility. The company will make cleaning supplies available to associates upon entry to the complex and will provide time for associates to wash hands frequently or use hand sanitizer as appropriate. Associates are encouraged to wash their hands and use hand sanitizer between customer service. We ask all associates, vendors, guests to cooperate in taking steps to reduce the risk of transmission of COVID-19. Best practices include frequent hand washing with warm soapy water, covering your mouth on the inside, covering your mouth with the inside of your elbow or a tissue whenever you sneeze or cough, immediately discarding used tissues in waste baskets, regular use of alcohol-based hand sanitizers. Dispensers are located throughout the property. Once you walk out there, you see, I don't know how many hundreds we have, but they're on stands in gallon jugs. And I know that there was a concern out there a couple weeks ago that listed some unhealthy or some kind of challenge with certain hand sanitizers, and I can confirm that that is not the brand that we use, and so that is safe to use. Talking about washing your hands, you've seen videos, you've seen people talk about it. There's 5 steps that the CDC requires and that it recommends, and that is wet your hands with clean running water and turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. So the whole process doesn't last 20 seconds. It's actually the scrubbing of your hands that lasts 20 seconds. Need a timer? Hum the happy birthday song twice, as you may have already heard. After that, rinse your hands with clean, clear running water and dry your hands using the clean towel or air dry them. Cleaning and sanitizing. So the company's implemented the following casino complex cleaning and sanitation protocols. The company will provide alcohol-based hand sanitizer that contains at least 60% alcohol. The company will also provide cleaning disinfectant products that are approved by the U.S. EPA for use against COVID-19. Prior to reopening, the company will clean and disinfect all of its hard and soft surfaces in accordance with the CDC guidelines. Enhanced cleaning protocols shall be used throughout the complex, including heart of the house areas and Michigan Gaming Control Board offices. Once open, high-touch point in publicly available areas such as escalator rails, door handles, light switches, elevator panels, buttons, countertops, faucets, restrooms, lobby check-in desk, dining tables, associate break rooms, sensitive keys will be disinfected frequently. They have schedules for timing and cleaning and individuals identified for doing this. The company will provide hand sanitizers for players and dealers at the table and throughout the casino floor. Tables in use, cards, dice, chips will be cleaned and disinfected in accordance with the gaming board requirements. Self-service hand sanitizers are also throughout the property. Nanoseptic, Bruce talked about it, it's pretty fascinating. It's a self-cleaning product. It's a strip that you see on the doors, and I still see it being added to different areas there, but it's nano crystals that self-clean, so they're activated by light. And if you do see those in your area and you want to clean them, please only clean them with water. Using anything else would take that off. They do have a pretty extensive life. I know that we had those tracked, and Paul and Eric have listed those in a smart sheet, and they know when to change those. So they last anywhere from a couple months to 6 months, something like that, but they have a tracker, and they'll replace those when necessary. Pretty cool stuff. Some property updates that we want to share with you. I think Bruce talked about some of those. We want to talk a little bit more, talking about the ADR itself. So the seating has been adjusted, as he mentioned, a chair per table. There's also be some overflow in one of the ballrooms. I think it's room C. There will be no buffet service, so when we walk in there, they'll ask us what we want, and they'll provide it to us. There are some areas, whether it's yogurt or water, that's in the station and it's a grab and go. Please, one touch. If you touch it, you own it or you take it. What we'd hate to do is touch something and put it back and potentially spread something. So again, please, one touch, grab and go. Utensils are all individually wrapped. We'll follow the signs. And again, when you walk in there, there's only one way to come into the ADR, one way to go out of the ADR, and just like the supermarkets and some other stores, there's one-way walkways there. So please adhere that. We know that there's probably a shorter distance to get from point A to point B, but our goal is to get everywhere where they need to go safely. So please take that extra time and follow the signs. Wardrobe. I can tell you, I'm hoping my pants and the button last. It's been 4 months and getting into them, but the changing room, there are changing rooms available. There are 3 people as opposed to the full amount there, so we've shut off a couple. If you're waiting in line, there's only going to be 1 person at a time. Don't drop your uniforms off all at once. I think we communicated that before. We want to make sure that we always have a uniform. And if you do, by chance, lose a button or need mending on your uniform, please fill out a uniform repair ticket. There is a commitment of a 48-hour turnaround. Anybody else scared to get into their uniform? The Ohio lot and the parking structure are the things that, or are the 2 places where we are parking. Again, I talked about the hotel walkway door being closed. Smoking shelter is closed as well. However, we just moved it over so that we can socially distance the urns. So it's right under the helix of the hotel. So that's the circle ramp. When you get there, it'll be our, what used to be the exit enter associate. It's just now the exit door. And then when we come back in, we're coming into the conference center. Until further notice, we leave. Whenever we come through the conference center, we're going to be tested again. So include that into your time if you're taking that break. Make sure that you understand that we may have to wait to take our temperature check again. Again, follow the signs. Some of the closed areas, so the spa and the gym or the fitness center are closed temporarily until further notice. Also iridescence and the buffet. Now the buffet is going to be used temporarily also for the signature lounge. It won't be a buffet style, but it will be used for our signature player, or in place of the signature lounge. Training and conference rooms, some will be used as offices, some have been readjusted, and again, you know, the ballroom, beautiful, just did a remake on it, gorgeous if you've seen coming into the hallway. We'll probably use that for any kind of training, some of the large spaces, but again, most of it has been closed down. Communal areas, so communal and shared food items, including catered food trays, potlucks, are prohibited until further notice. One of the things that we'll ask is when using countertops and surfaces, use disinfectant wipes to wipe off counters and tabletops after use. So I know that they have wipes and out there available to us, and when we use something, please wipe it down. We also have teams to do that as well, but anything that we can do to support that, we ask that happen. So let's take a closer look at some of these items that are found within communal areas. Refrigerators. Associates should use their own cooler and insulated lunch bag in lieu of communal refrigerators whenever possible. Leftover food should not be kept in the refrigerator. They'll be removed daily. We ask you to remove that daily. We'll be cleaning it overnight, so anything left in a refrigerator will be tossed out. Microwaves and vending machines. Associates are required to use napkins or wipe to cover your fingers when pressing the button. So if we do use something, make sure that we have a napkin or something there to push those buttons and or opening and closing doors. Immediately dispose of that used napkin. Wipe once you are done using the appliance itself. You must use a napkin or wipe to cover your fingers when pressing buttons on vending machines. And I do also know that when we are in the ADR, there are some items that are shut down as well, machines that are shut down. But again, everything is disposable there as well. Coffee and water stations. Associates may use disposable cups for coffee and tea. Don't bring coffee thermoses from home or into the office. Don't refuse a disposable cup. Use it once and toss it out, please. Before preparing coffee, those that are preparing that, making sure that we should understand what the cleaning process is, and that's usually the food team, beverage team out there that are working with that. Making sure that we are using all of our protocols. I would think that that's probably a task where an associate ADR attendant is going to wear a pair of gloves and then discard those after that task is done. But the department has protocols on that. Some miscellaneous information. Vulnerable associates. Based on the current information and CDC guidance, older adults age 65 or above, and people of any age who have serious underlying health conditions should consider whether or not they're at higher risk for contracting COVID-19 or other severe illness due to COVID-19. If you believe you or a member of your household is at heightened risk due to COVID-19, you're encouraged to notify Human Resources to discuss your concerns. Based on the current CDC guidelines, people of any age with the following conditions are at an increased risk: cancer, diabetes, serious heart condition, COPD, organ transplants, obesity, chronic kidney disease, sickle cell disease. Again, if you believe that you or a member of your household is at heightened risk, please, you're encouraged to notify Human Resources. What will happen is that after you notify your supervisor or HR, HR will discuss your concerns and provide guidance of what, if any, reasonable accommodations are appropriate. Reasonable accommodations may include alternative work arrangements, including remote working if feasible. As your needs and circumstances change, you are encouraged to update HR and discuss any needs for modified accommodations. HR will notify you of any adjustments in accommodations based upon the evolving COVID-19 pandemic. So the key here again is communication and ongoing communication as things change. Now, we mentioned it very briefly early on, but if there is suspected exposure, we have a process that we have listed, and I want to go through that now as well. In the event that an associate who has reported to work begins to show signs or symptoms of COVID-19, the company will take the following steps. The associate must report to a manager, supervisor, or the pandemic response officer, those again being Wendy Richardson and Satara Anderson from Human Resources. The pandemic officer will discreetly move the associate to a designated isolated location away from other associates and guests. If reported to a manager or supervisor, they will contact Satara or Wendy, who will take over the remaining steps of that protocol. They'll provide the associate with a face covering, although we all have face coverings. If they can tolerate it, though, there might be a circumstance in which that is the case. The pandemic response officer will gather the relevant information from the associate, including the symptoms, where the associate was working, and with whom the associate was in close contact with. They won't provide any medical advice. Tara or Wendy will direct and assist the associate to the exit and the complex to get medical assistance or transportation home as appropriate. If the associate demonstrates a single symptom, we will ensure that all areas in which the associate were working was isolated and are thoroughly sanitized and disinfected. If the associate demonstrates multiple symptoms, the company will immediately close the area in which the associate works. The pandemic officer will retain the list of associates with whom the associate was in close contact with. That's contact tracing, and that is a pretty detailed process. So we wanted to make sure that we shared with you that we do have protocols here if that does happen. Training and other resources. So to report any unsafe work conditions, you may have concerns there. Go on Create the Escape. There's a comment button there. We are actually creating another widget there that will say unsafe work conditions, but right now we've designated the comment section there. So go ahead and communicate that or communicate to your supervisor, manager, or pandemic response officer. Anything, we get that information and then we're going to follow up with that as quick as we can, certainly. Create the Escape. I think over these last few months, we've been getting texts to say, hey, there's an update, check it out. So that's still there. Employee Assistance Program is a great one too. Again, one of the things that happens in this type of a situation, there are some stress, there are some concerns. The Associate Assistant Program is a great resource to reach out to and talk to somebody out there. And then CDC has some great resources. In fact, I know we have multiple languages spoken here and in the households outside. They have a lot of their safety material in multiple languages. And we checked, and at least I checked, and I know doing the surveys, they have all of the languages that we put some other communications, like when you did the associate survey, they have those available. So that's a great resource to reach out to. So I told you about questions and not being able to take the questions, and I want to share with you the individuals to contact in Human Resources. Certainly your manager or supervisor is another individual to ask these questions, but David Turner is our Vice President of Human Resources, and Joanne Taylor is our Director of Human Resources, and we have Satara Anderson is our risk manager. Wendy Richardson works with benefits, and both those two are our pandemic response officers as well. And then, of course, our associate assistant program can answer any question that you may have concerns over as well. So those are some people we encourage you to reach out for on any questions here. So we certainly want your feedback again. There is a suggestion box, electronic file on Create the Escape. If you've used that in the past and you're comfortable, please use that as another resource of communicating with us. We'll certainly follow through. We'll look at that. And if we need to get back, it certainly will commit to getting back on a timely manner. And the last few things I want to go over are some things to remember. Again, the concern if somebody shows symptoms or is positive, we do have a process here on property. We have our pandemic response officers. They're going to identify the situation, isolate the associates confidentially, and get the information, inform them what that process is, interview, gather the information that we can, and then clean and disinfect appropriately. The signs, again, one-way traffic is out there. The arrows, the markers designate the traffic direction. Signage promotes social distancing. So again, you'll see a lot of signage out there. We just ask, please be aware of it. And sometimes we can get lackadaisy. We may find ourselves a week later, a month later, knowing there's a shortcut. Please avoid that. Let's just get into a good habit of following these signs and protocols, because that'll allow each of us to check one another on this. Again, we have 1,300 people coming back, and we want to bring more people. And one way to do that is every effort that we can to check ourselves, check each other, and ensure that our guests are enjoying themselves, but also following the guidelines. Some of the healthy habits that we've talked about, again, avoid commonly touched surfaces, avoid direct contact when we can, don't share personal items, and stay within your workspace when that's feasible. Virtual meetings, I know that over the last few months, Microsoft Teams, again, Paul and Eric did a wonderful job of setting everybody up. There was new technology, and everybody started to communicate that, and I know we're still learning, but there were some real superstars here, and certainly hope that we have an opportunity to share their stories. Wipe down surface areas and use visible distance markers when doable. Again, we thank each and every one of you for attending this by adhering to the correct policy and procedures shared with you today. We increase the opportunity for each of us to stay safe. Please keep a lookout for any updates and information shared throughout the property, such as Create the Escape, back of house screens, and departmental communications. Now, there are going to be some departments after each one of these sessions that are going to meet up with their team. And so today, this morning, anybody from the Cage team or retail, we ask that you meet your leader outside of MotorCity 4, conference rooms 4. So if you're if you're in soundboard, it's out the doors to the right at the end of the hallway. If you're in the ballroom, you're coming out and you're taking a left to the end of the hallway. What I can only do is encourage, again, please don't congregate, remain social distance. Your leader will be there, and the rest of us can now exit through the soundboard exit here. So those in the soundboard, walk up here. Those in the ballroom, there's arrows that'll take you through soundboard as well. Once again, ladies and gentlemen, it's exciting to see you all. It's really going to be exciting over these next few days, weeks, and months. And I think it'll just, we're going to rely on each other to support and make sure that this happens right. Thank you again.